opioid crisis is now claiming the tiniest of victims. On this week's edition of Today's Health, we learn that hospitals are seeing a spike in babies born addicted to drugs like heroin. John Rogers reports.
Yes, you are.
Pat Saxon spends her days cuddling preemies at Sarasota Memorial Hospital. She watches and feeds these babies before they're sent home, but some are harder to care for than others.
You can tell from the screams and the crying that you can pretty much pick out which ones are the drug babies before you walk in a room.
It's called neonatal abstinence syndrome, and it occurs when the pregnant mother is addicted to illegal narcotics or opioids, like heroin.
It's sad. I mean, the babies are you can't console them at times. They have tremors, they cry a lot, they have a hard time eating.
Dr. Tony Napolitano says these babies are medically treated for weeks to wean off the drugs, and the consequences are long-lasting. Studies have shown drug-addicted babies experience learning difficulties as they grow older.
They're having problems with not being able to learn very well. They become somewhat dysfunctional. So even as they're getting into the adulthood, early adulthood, some of these early children are having problems later on in life.
Doctors are hopeful these mothers seek help before it impacts more innocent victims.
In other health news this morning, race may play a role in whether people survive a first-time heart attack. A new study shows African Americans have a similar risk of heart disease as whites, but their first heart attack is twice as likely to be fatal. Researchers believe this may be due to a combination of genetic and lifestyle factors. Also, African Americans may be less likely to seek medical attention for possible heart attack symptoms. A new Stanford University study reveals the hormone oxytocin may improve social behaviors in kids with autism. Children with low oxytocin levels benefited the most from the medication, which was given twice a day for 4 weeks. Oxytocin treatments did not change the frequency of repetitive behaviors or children's anxiety levels. Allowing infants to control how much they eat does not appear to affect their weight as toddlers. Researchers in New Zealand asked about 100 moms to delay the introduction of solid foods until their babies were able to feed themselves. This approach did not reduce the risk of obesity by age 2 compared to traditional spoon feeding practices. Infants who fed themselves were less likely to be picky eaters. That's it for this week's edition of Today's Health, and coming up on KPVI News Today, we take a look at your KPVI News Today headlines.